Today I'll be talking to you about some of the family planning method. So when I raise one of the family planning method and you know it, you can just say it. So this week, this is it. Okay. This is it. Okay. And we have that's the next one. So I'll be telling you about the withdrawal, the rhythm method, the male condom, the female condom, the pill, and the injection. Okay, the withdrawal. So the withdrawal, as you say, withdrawal is basically when the man is having sex, and in this case the man doesn't use any protective method. You just go, Jamaica will say, bareback. So you're having sex, and when the man think it's time for him to ejaculate, he will just pull out his penis from the vagina. So this type of family planning, it doesn't protect you against any STD, or it's not 100% safe if you don't want to get pregnant. So if you don't want to get pregnant, you should not choose this method. Unlike most family planning, you don't have to go to doctor to remove it. If you just want to start your family later on down the road, you can just start the family, because you don't have to really think about what if I don't, what if the operation didn't go through, or what if, just what if. Yeah, it's okay. So the next one I'll be telling you about is the rhythm method. And as you say, rhythm is like a flow. It's something that you have to work with. It's something that you have to remember, and it's something you have to practice. So if you have a regular period, because some people menstrual cycle, some people don't have a regular menstrual cycle, they have an irregular menstrual cycle. So if you have a 28, or if you see if you menstruate for 5 days, you could try this method. Okay, so we are in the month of November, and say for instance your period starts the 1st, which would be Monday. Okay, so you have period the 1st, the 2nd, the 3rd, the 4th, and the 5th. So that is 5 days of period. So between the 6th, the 7th, the 8th, 9, and the 10, within these days it's safe to have sex. So between the 11th to the 16th, it is not safe to have sex, because between this time a egg will be releasing, and if you have sex within this time, and if there's a egg and there's a sperm and it's meet, then you will get pregnant. So between the 17 and the 30, it's okay to have sex again, but it's a risk taking. If you're sure you don't want to get pregnant, you don't want to try this method. So between the 11th and the 16th day, between the 11th and the 16th days, if you're having sex, you can use a condom, because you're not sure if there's a egg, even though an egg is released, you're not sure, so you want to be sure. So between that period, you would use a condom. So the sperm normally lasts for 3 days, so within those time you would maybe want to use a condom. So that's basically the rhythm method. This right here is a female condom. For those of you who don't know what's a female condom, this is what the female condom look like. So when you have the female condom, you can get it at the clinic or over the pharmacy. So when you have the female condom, you check. There are certain things to check for. You check to see if it's still sealed, if there are air coming out of it. You check to see if it's broken or it's damaged. You check for the expiry date up here. You check for the CE sign. This is to show you that it is certified. So after you check all of that, and you're going to use your condom. If you have problem with your body parts, your female body parts, and you're very sensitive, this is not recommended for you. But if you're okay with it, you can. If you're okay with your body parts, you can use this. So you will tear it. You don't want to bite it because you might bite it and damage it. So you normally tear, and the safe side will be here. The gritty part right here. So you would tear right here. So you would tear it, come down like this. So this is a female condom. For those of you who've seen the female condom for the first time, this is a female condom. Okay, so you normally insert this some minutes or so before you're having sex, because you want to make sure that you're comfortable and it's in the right position. So you're going to insert this first, because if you don't insert it first and you're anxious and the man will come rushing, and if you don't insert it, it maybe just go, it might go behind the condom, and you will not know because you're excited and you do your thing, and then you just find out you got pregnant, and you will say, how did I get pregnant? And I use a female condom. So when you're using the female condom, you're going to make an 8 with the ring, and you're going to insert it into your vagina. So assume this is the vagina. You're going to insert it into your vagina. So you're going to, so if you want, you can use this with lubricant, but it's already come with its own lubricant. So if you're not sure, you can ask over the counter which lubricant you can use. So this is a vagina. You're going to insert the female condom into your vagina. So you're going to insert it like this. See, you insert it like this. So after you insert it, you're going to leave this part outside, the bigger part, and it's going to be like this. So this would be the vagina, right? And this would be the penis. Say this is the penis, right? The penis gonna be like this into the female condom, not outside. Yeah, because you could be doing this, you know, I don't know that the penis is not inside the condom, so you want to make sure you insert it before you have sex. Okay, so after you insert your female and you have sex and the man finish, and he's going to remove his penis, so you're going to twist the end of the female condom, because you don't want it to spill in your vagina, or you don't want it to spill on the ground. So you're going to twist it like this, and you're going to pull it from your vagina. Then after you pull it from your vagina, you're going to tie the end of it, because you don't want any to release. So after you're finished with the female condom, you can just put it in a napkin or a tissue and you roll it up. You can put it back into the same plastic. Put it in your bin, or you want to put it into a bag, a next bag, and you just put it in your bin. But you can also check the condom at the end of the sex to see if there any discoloration or if it was broken during sex. Okay, so the female condom, it helps to protect you against pregnancy and any STI disease. So the next one we'll be looking at is a male condom. So here I have a male condom. See? So you're going to check the male condom to see if it's puffy. You check the expired dates right down here. You check to see if everything is intact, if it's loose in here. So after you check all of that now, So after you check your condom, now you're gonna pull your condom. So this is the gritty side of the condom, so you're gonna pull it like this. You don't normally bite it because you don't want to damage the condom, so you're gonna pull it like this. So here you have your condom. So you're gonna roll, pinch, leave an inch and roll it onto your penis. So assume that this is the penis. You're gonna make sure that the reason why you pinch is that because you don't want to leave any air at the tip of the condom. Because when you're having sex, the friction and it can break and you don't know because you're having sex and your mind is somewhere else. So that's the reason why you try not to make sure there is no hair at the top. So you're gonna get your penis and you're gonna roll the condom onto your penis. After you roll the condom onto your penis and you have sex, you're gonna remove the condom from the penis. By this time the penis will be deflated, or it's not stiff or it's not erected anymore, so it's easier to remove the condom from the penis. So I'm removing the condom from the penis. So after I've removed my condom from the penis, you're going to check to see if the condom is broken or if there is discoloration on the condom. And you know, if otherwise from a clear color, you should seek assistance to check out yourself to find out if something is wrong with you. So after you check all of that now, you're gonna tie your condom because you don't want it to spill on the floor. After you tie your condom, you're gonna get your tissue or your napkin and you're gonna wrap it up into the napkin. You can put it into your bin or you can get a next bag and you put your condom inside and you tie it and you put it into the bin. You don't want to put it in the toilet because it cannot flush and it will block your toilet. So this is a family planning and it's a pill and it's a mini guyang. So you have the 21 days and you have the 28 days. You have the pills with period, pills without period, and the pill with pain. The reason for taking a pill is to prevent the release of egg from the ovary. So if there is no egg, then no fertilization will take place. For every 100 female that take this pill, 99% it's proven that you will not get pregnant. This pill only helps to prevent pregnancy. It doesn't prevent STDs. So if you don't want to get any STDs, you should use a condom with the pill. Okay, how do you take the pill? So you take 1 pill per day and you should always take the pill the same time every day. So you're going to take 1 pill Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday, Monday, Tuesday, Wednesday, Thursday, Friday for the 21 days. And you're going to break for 7 days. So during these 7 days, you will see your period. And then you will start all over with a different pack. Use a different pack and you take it for Monday, Tuesday, Wednesday, Thursday, Friday, Saturday. Okay, so if you don't want to see any period and you take the pill for 21 days, you would buy a next pack and you continue the following day. So for instance, you finish take the pill Sunday, this pack of pill, and if the pill finish, you buy a next pack for Monday. So you continue to take it Monday. So if you want to take the pill, if you want to take the pill, it helps you. It's prevent you from getting pregnant. But if you want to get pregnant, then don't take the pill. A person who is breastfeeding can take the pill 6 weeks after they start breastfeeding. If you are not sure, then you can consult your nurse about certain things. If you start to take the pill after your menstrual cycle, I would advise you to use a condom. But if you start to take the pill during your menstrual cycle, then you don't have to use a condom. Persons who should not take this pill are persons who have high blood pressure, if you are bleeding, if you smoke, if you have yellow in your eyes. So if you have any of these, I would advise you not to take the pill. What are some of the side effects? You have nausea, you maybe have bleeding, you might vomit, you might have headache and tenderness of the breast. So for the 28 days pill, the brown ones are the iron tablets. I don't have that one. So when you're taking the pill, you would see some brown one at the bottom, some darker brown one. They are the iron tablets. So we'll take the regular 21. So when you 21 days pill like this. So when you start to see your period, you would break and take the brown one, because you know that you lose blood and you want the count. You want that blood that you have lost. You're going to take the iron tablet, but that's for 7 days, and after the 7 days you're going to start to take back the white pills again. So this in my hand is a Depo-Provera. So the Depo-Provera is a contraceptive injection, and it is given every 3 months. It contains the hormone progestin. It suppresses ovulation, keeps the ovary from releasing egg. It thickens the walls of the cervix to prevent sperm from attaching to a egg. This type of injection is normally given in the muscle or injected in the muscle, normally on your shoulder or on your buttocks. People use this method because if they have menstrual problem, to avoid estrogen. In this case, you don't have to take a pill every day. For persons who are anemic, who have seizure, fibroid, some of the benefits for using this method, it is not something you have to take every day. It reduces menstrual cramp. It decreases the risk of endometrial cancer, and it also doesn't disturb your sex life. If you have health problems such as cancer, liver disease, depression, history of bleeding, heart attack and stroke, it is not recommended for you. 6 out of every 100 persons who use this type of contraceptive normally get pregnant. This type of method is not recommended to use more than 2 years. One of the reasons is that after a period of time, your minerals in your bone will decrease and you will have bone problem to come. Some of the side effects include bloat, lack of sex, depression, dizziness, headache, weight gain, irregular period. So if you find yourself having some of these effects, you should consult your doctor. This type of contraceptive is normally given to persons 7 days after they see their period, or if you are breastfeeding, it's normally 5 days after you start breastfeeding. This type of contraceptive doesn't protect you against STDs or STI, because if you don't want to get these diseases, I would encourage you to use a condom. When you are planning to go on this type of contraceptive, it is recommended that you should do a pregnancy test. You don't want to go on this type of contraceptive and then you are pregnant and you didn't know. So it's best to do a pregnancy test. When this type of contraceptive is being applied to you, normally the nurse will sterilize the area that you're supposed to get the injection, and they normally inject you in your muscle. After you get the injection, you're not supposed to rub the area. You're supposed to press it to stop the bleeding. This type of contraceptive is a long-term method. Unlike the condom, the rhythm method, the withdrawal, the female condom, which is called the feminine, is a short-term method.